Guys, gals, everything in between. China's mystery new coronavirus has so far infected at least 291 people and killed 6, with the WHO, which is the World Health Organization, set to meet to determine whether the outbreak should be categorized as an international health emergency. Gee, you think? While the vast bulk of cases have been confined to China, cases in this fast-moving outbreak have now been found in Thailand, South Korea, Japan, and the Philippines. By the way, about 10 to 15 minutes ago, there has been one case now reported in the U.S. Experts around the world are on high alert after authorities confirmed that the virus could jump from human to human. That's a pretty scary thought, man. But although it remains unlikely that the outbreak will grow into a global epidemic, experts have been warning for years that the world is long overdue for a major pandemic. And so it is sensible to be prepared. This guide, which I will give you, will be underpinned with the best advice from leading experts from the NHS and beyond. Okay, so basically, what are the symptoms of the new coronavirus? According to the WHO, the new coronavirus causes a fever, fatigue, sore throat, and dry cough in the early stages of the disease. As the illness progresses, patients may experience difficulty breathing. Sounds a lot like SARS from years back. Very, very similar. But these symptoms, similar to many other respiratory diseases, are what makes it so difficult to control. The virus was initially described by Chinese authorities as a new strain of pneumonia, but was later confirmed to be a novel coronavirus. These are a family of viruses that originate in animals before making the jump to humans. 7, including the new virus, have been found in humans, with 4 causing only mild, common cold-like symptoms. But 2 Middle East respiratory syndrome, short form for MERS, M-E-R-S, and severe acute respiratory syndrome, which was SARS, are much more severe, having killed more than 1,500 people between them. So the question is, how are coronaviruses transmitted? Well, like other coronaviruses, such as the common cold, the virus is spread via droplets when a person coughs or sneezes. It can also be spread when someone touches a contaminated surface, such as a door handle. Hospitals are also a key place for viruses to spread. When patients arrive in hospital with vague respiratory health workers may not know they need to take special precautions such as wearing masks. Other patients may also be at risk. The outbreak is thought to have originated in a seafood market in Wuhan, which also traded in other animals such as marmots and bats. But what animal the disease originally came from is still unknown, as is how the disease spreads between people. WHO and the Chinese authorities initially said there was limited human-to-human transmission, but the pace of the outbreak would suggest that it spreads more easily than first thought. Another question you guys have is, can the new coronavirus be treated? Well, there are no specific treatments for coronaviruses, just as there is no treatment for the common cold. Anyone with a severe form of this disease will receive antiviral medicine and support for symptoms. Patients may need ventilation to assist breathing as well as support for their vital organs. What can you do to limit the risk of catching the new coronavirus? The risk to the UK is currently low, but anyone traveling to China and worried about catching the virus needs to take the basic hygiene precautions. Coronaviruses typically cause respiratory symptoms, so we recommend basic hand hygiene such as washing hands in soap and water, and respiratory hygiene, so when you sneeze, sneeze into your elbow. As the source of the virus is an animal, still unknown, against any unnecessary contact with live animals is suggested. She urged anyone having contact with animals to wash hands thoroughly with soap and water. Meat should also be cooked thoroughly. Travelers to China should also limit their contact with people showing respiratory symptoms. Nick Finn, who is a Deputy Director of the National Infection Service at Public Health England, added, individuals should seek medical attention if they develop respiratory symptoms within 14 days of visiting Wuhan, either in China or on the return to the UK, or basically anywhere else in the world, I would say, informing their health service prior to their attendance about their recent travel to the city. So what advice has the government issued? The government has not issued any travel or trade restrictions with China and says the risk to the UK is currently low, and even the risk to travelers to Wuhan, a city of 11 million people, is also low. However, it says its advice is constantly under review. So, have international travel warnings been issued? The European Centre for Disease Control updated their risk assessment on Tuesday, saying that there is now a moderate rather than low chance the virus could reach the European Union. The agency flagged the 3 airports in the EU that have direct flight connections to Wuhan, including London Heathrow. Therefore, the likelihood of infection for travelers visiting Wuhan having close contact with symptomatic individuals is considered moderate, and the likelihood of importation of cases is also considered to be moderate. But the risk of international transmission remains highest in Asia, where cases have already crossed borders. Tighter screening measures have been introduced at airports across the continent, as well as in Australia, New Zealand, and at 3 major transit hubs in the United States. But screening cannot pick up everyone, as the incubation period for contracting the virus and the onset of symptoms is between 6 to 10 days. Professor David Hyman, infectious disease expert at the London School of Hygiene and Tropical Medicine, said, "Temperature screening picks up where people with fevers, but people can take aspirin if they want to travel and don't want to get picked up. The best thing to do is educate people. If you're sick, you should tell a doctor," he said. My opinion is if you're sick, you shouldn't be traveling at all. Anyway, another question is, are certain groups most at risk? Chinese authorities and the WHO have said that older patients are more likely to have a more severe form of the illness. At least 2 of the deaths have been among elderly people with underlying conditions. A 5-year-old boy in the Philippines is also reported to have contracted the disease. So what is the difference between a coronavirus and a flu virus? Coronaviruses and flu viruses might cause similar symptoms that can differ dramatically in terms of severity, but genetically they are substantially different. Flu viruses incubate very rapidly. You tend to get symptoms 2 to 3 days after being infected. But coronaviruses take much longer, said Professor Neil Ferguson, a disease outbreak scientist at Imperial College London. With the flu virus, you become immune, but there are lots of different viruses circulating. Coronaviruses don't evolve in the same way as flu with lots of different strains, but equally, our body doesn't generate very good immunity. So, how does the coronavirus compare to past respiratory pandemics? The 1918 Spanish influenza, or H1N1 virus, remains the most devastating flu pandemic in modern history. The disease swept around the globe and is estimated to have caused between 50 and 100 million deaths. Sometimes known as the forgotten epidemic, as it was overshadowed by the First World War, transmission was exacerbated by the movement of troops at the end of the war, the poor living conditions of many at the time, and a lack of antibiotics to treat secondary infections. The same virus was also behind the 2009 swine flu outbreak, which is thought to have killed as many as 575,400 people, the majority of whom were in Africa and Southeast Asia. Other major influenza outbreaks include the Asian flu in 1957, which led to roughly 2 million deaths, and the Hong Kong flu 11 years later, which killed 1 million people. But coronavirus outbreaks have been far smaller. SARS was first reported in China in November 2002. By March 2003, cases has emerged in Thailand, Singapore, Hong Kong, the Philippines, United States, Germany, and Vietnam. It eventually spread to 27 countries in total, infecting around 8,000 people and killing 700. MERS, on the other hand, has proved less explosive, but more tenacious. It first emerged in 2012 in Jordan, when it jumped from camels to humans, and then spread throughout the Arabian Peninsula. Around 2,500 cases of the disease have been identified so far, and while the disease hit a peak of more than 600 cases in 2014, there were still more than 190 cases last year. It is more deadly than SARS and has claimed around 850 lives in total. That's the latest as far as this goes. Guys, gals, everything in between. Keep yourself safe. If you like this video or any of my other videos, but especially this one, comment down below. I'm going to reply to each and every one of you. If you have any questions, concerns, whatever it may be, like I said, leave a comment. I will reply to each and every one. I would also appreciate if you guys would subscribe to the channel, like the video, give it a thumbs up, subscribe, hit the bell icon, be notified whenever I do make a new video. I appreciate each and every one of you for taking the time to listen to me, and I hope you all stay safe, have a great day, and again, just be safe, all right, guys, gals, everything in between. Take care for now. Mavakaga exclusive.